Hi, I'm Dr. Tony,
And I'm pharmacist Karan.
and we are so happy to welcome you to another edition of Can
Can
We
we
Talk?
talk?
Quran. So many people are excited about the possibility of losing all the weight they ever wanted to by simply using a once a week medication like Wegovy, which is the same as Ozempic used for diabetes. Are these GLP-1 drugs really the weight loss miracle we've been looking for?
Well, Tony, once Novo Nordisk saw that Ozempic was helping people with diabetes lose weight, they simply rebranded Ozempic with a new dosage, increasing the dosage by 240% to 2.4 milligrams and named it Wegovy. Unfortunately, it retails for $1,600 per month on GoodRx, and the GoodRx discount only reduces the cost around $1,300 per month at most pharmacies. That's a cost that is not sustainable for both the customer or the insurer.
I do understand why people are excited about reading this trial for the drug since it did result in significant weight loss. Although, as a clinician, I must caution people that the trial was sponsored by the pharmaceutical company who makes the drug. So there was some potential bias there. On the other hand, it was a double blinded study with about 1,900 participants, so it really appears to be a quality study.
That's right, Tony. And yes, the weight loss was better than any other obesity drug before it. And it seems to work via the GLP-1 receptors in the brain to reduce food intake and decrease hunger. And as you know, weight loss is much easier if you are not hungry when trying to lose weight. With such great results, are there any reasons to not use this medication?
You know, with all medications, there are risks. So let's pause for a moment and review a few. Number one, it has a black box warning since in mice there is a dose-related increase in thyroid C-cell tumors. So it's important that we monitor for this in humans. Number two, the side effects were significant, including nausea, diarrhea, vomiting, constipation, abdominal pain, headache, fatigue, upset stomach, dizziness, gas, indigestion, and heartburn. Number three, pancreatitis was also a side effect, and therefore this drug should be avoided in patients with a history of pancreatitis. And lastly, it's pregnancy category D, and therefore should be avoided in patients who are trying to get pregnant.
Thanks for sharing those warnings. Now let's share our takeaways from this video. The first is that the cost of the drug and ultimately the challenge of getting it approved by your insurance company. Tony, you did a video about this with another pharmacist on this channel, so maybe we can share that link for those who need it.
I definitely plan to do that. The second takeaway is that Wegovy may be okay as bridge therapy to get you started while you adopt the proper lifestyle changes, including a low carb or carnivore diet. Just keep in mind that when you reduce carbs, you will naturally reduce your appetite, reducing the need to take medicines like Wegovy to help you achieve your weight loss goals. I'll share the definition of GLP-1 drugs in the video notes.
The third takeaway is that you can avoid that long list of side effects mentioned earlier by first trying a low carb lifestyle. And with most people, they will never need medications to lose weight. Consider clicking on Tony's link tree in this video notes to get started by watching his How to Adopt a Low Carb Diet video.
Finally, always remember, lifestyle changes via low carb can lead to more sustainable weight loss. It's much cheaper than medication and removes the needs for a weekly shot. And yes, according to an April 2022 study published in Diabetes, Obesity, and Metabolism, most people gained back a majority of the weight they lost within 1 year of stopping Wegovy.
So true, Tony. And hopefully these tips will help guide our followers to a more thoughtful decision on this topic. So until our next video, stay safe and healthy.